Indiana's ban on abortion takes effect September 15th. Governor Eric Holcomb quickly signed the bill into law last weekend at the end of the General Assembly's special session. Pat Bean has this report.
Indiana became the first state in the U.S. to enact new legislation after the Supreme Court overturned Roe in June. Abortion soon will only be allowed if the pregnant person's serious health or life is at risk, if there is a lethal fetal anomaly up to 20 weeks, and in cases of rape or incest, but only up to 10 weeks. Those exceptions would have accounted for about 2% of the just over 8,400 abortions performed in the state last year. The ban was the culmination of years of battles by the anti-abortion rights movement and the GOP.
We will always have more work to do because we need to make it unimaginable to end an unborn baby's life.
Republican Representative Wendy McNamara says the bill makes Indiana what she calls the most pro-life state in the country.
It is consistent with our overall goal to care for mother and baby.
Democrats say women shouldn't have to ask for control of their own bodies.
It's not compassionate. It's not pro-life. It's pro-punishment. Punishment of women who dare to live as freely as men.
The bill passed shortly after Kansas voters rejected a ballot referendum that would have banned abortion in the state. That left some wondering why the question about abortion isn't on the ballot in Indiana this November. But House and Senate Republicans rejected efforts by Democrats to do so.
They don't want to hear from Hoosiers across the state of Indiana who know that bodily autonomy is just the first step in taking away some of our constitutional rights.
Democrats also pointed to data from a GOP poll prior to the vote that suggested 63% of Hoosiers wanted to keep Indiana's abortion law as is. For Indiana News Desk, I'm Pat Bean.
We're joined now by Dr. Katie McHugh, a OBGYN with IU Health in Indianapolis, for more on what the ban means in the state. Welcome to the show, Doctor.
Thanks for having me.
So we've already seen a women's health clinic in South Bend announce its closing once the ban takes effect. What kind of impact will the ban have on women's health care in the state?
Banning abortion access is not just about abortion. Banning abortion access takes away the choices that people have to make about their own bodies and their own futures. This will impact the health of lots of our fellow Hoosiers, our neighbors and friends, in ways that's more than just about pregnancy. Instead, this will impact their long-term health. This impacts the ability for people to stay in Indiana and affects the ability of people to raise their families here in our state.
So with so few exemptions, threats of prosecution, will doctors just stop doing abortions altogether?
It's going to be illegal to do elective abortions here in Indiana, and the restrictions will prevent most abortions from being performed at all, even in a hospital setting and for medical reasons. Patients will not be able to choose their own life and health above their pregnancy. They'll have to leave the state to be able to make their own decisions about their bodies and to be able to choose what happens to them, their families, and their futures.
You know, people with the means will be able to travel out of state for an abortion, but how concerned are you for those that just don't have that option?
There are abortion funds and organizations to help provide funding and resources for people who don't have the ability to leave the state or don't have childcare or coverage at work, things like that. There will be online accessibility for people who are able to access that, but for many, many people, abortion is simply going to be out of reach. This is going to have an incredible tax on our state's economic situation, on our welfare system, on our schools and hospitals. The impact is overwhelming to consider and certainly not something that the Indiana State Legislature considered before passing this bill.
How about the concern about being able to attract medical staff to the state now going forward?
There's already research being done saying that people who are currently in Indiana want to leave Indiana because of this ban, because of our inability to provide evidence-based care and the care that is recommended by our national organizations. It is certainly going to be more difficult to attract physicians to Indiana to practice when we have a state that restricts us so much. And patients themselves themselves are not going to want to live in Indiana. We've seen businesses coming out with support for their employees to leave the state to get health care in the form of abortion, and that's not going to be the end of it.
Now, Indiana already has a pretty high maternal mortality rate. Do you expect the ban to affect that as well?
It's such an important topic. Maternal mortality is so misunderstood, and it is the worst in states without reproductive access and without health care that treats both the mother and the child. Indiana ranks very highly in our maternal mortality rate. This is not a race we want to win. The United States is the worst among industrialized countries, and then Indiana is 46th in the state, in our country, as far as maternal mortality. It is a very dangerous time to be a pregnant person in Indiana.
Doctor, we have to leave it there. Thank you so much for your time. Appreciate it.
It's a pleasure. Thanks for having me.